we're going to start with a high-level walkthrough and really set up the challenge, the problem that we are facing with regards to opioids in the US. We've talked about the crisis on Today in Health IT, and the problem really has worsened in 2020 and 2021, presumably due to the pandemic. It seems to have impacted everyone everywhere. According to the Commonwealth Fund, the research showed that every state, it got worse. Every demographic, it's gotten worse, especially with males, younger age groups, and communities of color. Scott, I'd like to start with you. Can you kick us off and give us an idea of the challenge that we are currently facing with this?
Yeah, thanks, Bill. Thanks so much for having us. It's been nothing short of tragic. And it's really unfortunate, particularly because of COVID, right? Because everyone has been focused on COVID and the terrible numbers we're hearing of people that have died from COVID and affected by COVID. Underlying this, we have this ongoing epidemic of overdose deaths, which have been plaguing us for the past 20 years now. So from kind of 2010 on, we just saw this incredible increase in deaths every year. And around 2018 to the beginning of 19, there was finally a glimmer of hope. It kind of stabilized around 65 to 70,000 deaths, which it's tragic to say that's good news, right? But it was finally stabilizing. We thought we'd reached the peak and that we were going to see the end of this epidemic and it would start to get better with everything we're doing. And then COVID hit, right? So unfortunately, the numbers from 2020 were the worst we've ever recorded. 93,000 people died from overdose-related death. About 2/3 of those were from opioids. And like you said, it's been disproportionately affecting certain populations too. If you look at people that died from COVID, the most affected age group are those that are 85 and older. And that's unfortunate, of course, but they've been able to live a full life. People that are losing their lives from opioids and drugs, the most common age groups are like 25 to 44. People really in their prime when they should be experiencing life, working, developing a family, and their lives are just getting lost and stolen from them. And as you mentioned, particularly for communities of color, it's been extremely tragic. In Massachusetts, where Sean and I work, we saw a relatively modest increase of opioid-related deaths, about 5% last year. But the number amongst Black males increased 69%. So it's just been tragic. And this is happening all over the country. I think Minnesota, twice as likely to die from an overdose if you're Black compared to white. It's just every single community is feeling this. And it just shows so many gaps that have been uncovered because of COVID.